75. Man for neck pain having posterior vertical scalloping of C4 to 7 vertebra. Cord was expanded by a well-defined tumor and trench homogeneous containment, most likely diagnosed ependymoma. And C-spine seen in ependymoma. So posterior vertebral body scalloping and then a G4C found and cord was expanded by a well-defined tumor, most likely diagnosed ependymoma. Posterior cervical vertebral body scalloping, ependymoma. And meningioma is going to be seen in 46-year-old female. And then thoracic spine. In 76, which adrenal MRI characterizes is likely to suggest progressive multiple frequency encephalopathy or HIV encephalopathy, involvement of subcortical U fibers, is seen in progressive multiple encephalopathy or HIV encephalopathy. 77, 18-year-old toddler with developmental delay. Biochemical test abnormality lower levels of aryl phosphatase, an enzyme preventricular abnormality to trigot pattern, most likely diagnosed condition, metachromatic leukodystrophy. Trigot pattern seen in metachromatic leukodystrophy. 78. Man with Peyronie syndrome finding pineal tumor. Man with Peyronie syndrome finding pineal tumor. 79. What typical feature makes medulloblastoma more likely than ependymoma arising from the vermis? Medulloblastoma arising from the vermis. 80. A 44-year-old girl with nausea, hyperdense mass in the vermis that expand the fourth ventricle, most likely diagnosed medulloblastoma arising from the roof of the fourth ventricle, medulloblastoma. 81. A 7-year-old girl with headaches, hypertension lesion in the region of posterior fossa, midline vermin mass which abuts the roof of the fourth ventricle, most likely diagnosed medulloblastoma, and spreads by 40% of CSF seeding, whereas ependymoma arises from fourth ventricle floor and spreads through the foramen of Rushkan McGinty. 82. Recurrent medulloblastoma spreads through seedling down the spine. 83. Which imaging feature favors the diagnosis of toxoplasmosis rather than primary CNS lymphoma? Hypothyroidism in AMR perfusion study. Lymphoma is hypervascular and toxoplasmosis is hypervascular. 84. Precognate puberty and supracellular mass attached to the memory bodies of thin stalk most likely causes hypothalamic hamartoma. Precognate puberty and supracellular mass attached to the memory bodies of thin stalk most likely causes hypothalamic hamartoma. 85. Mesial temporal sclerosis. What imaging plane would you pay particular attention to and what would you expect to find in condition? Coronal plane demonstrating volume loss and increased signal intensity on the hippocampus on T2 imaging. Mesial temporal sclerosis. What imaging features? Coronal plane demonstrating volume loss and increased signal intensity in the hippocampus on T2 imaging. 86. Which sequence is best to evaluate the temporal loss for signs of mesial temporal sclerosis? Coronal T2. 87. Newborn child with failure to thrive, foci and perimetric distribution, extensive calcification, diagnosis, hydrocephalus. So, congenital circummechanical virus infection, child with failure to thrive, and then there's no hydrocephalus and no evidence of causal adjacent. These kinds of extensive calcification in subabdominal region most likely diagnosis is circummechanical virus infection. Correct? 87. CMV infection, C87. So there's extensive calcification and perimetric distribution of CMV infection. 88. On X-ray, JSF salicinin, chronic hydrocephalus. आवाज आ रही है?
Yes, sir.
Yes, sir.
आई तो नहीं थी ना? On X-ray, JSF salicinin in chronic hydrocephalus. 89. Positional headache, CT shows well-defined hyperdense lesion, spherical lesion in the anterior superior portion of the third ventricle, most likely diagnosed colloid cyst. Positional headaches and well-defined hyperdense lesion in the anterior superior portion of the third ventricle, most likely diagnosed colloid cyst. 90. Bilateral globus pallidus injury is indicated by pointing with which substance? Carbon monoxide. Bilateral globus pallidus injury is indicated by pointing with which substance? Carbon monoxide. 91. Pediatric MR and CT shows well-defined lobulated mass within the left lateral ventricle, hydrocephalus, most likely diagnosed choledochoric papilloma. Pediatric MRI and CT shows well-defined lobulated mass within a trilateral left lateral ventricle, hydrocephalus, and it is also attached to the septum. It's supposed to attach to the septum pellucidum, diagnosed choledochoric papilloma. 21. And 2. Progressive bilateral leg weakness. MR lumbar spine shows multiple tortuous tubes with signaling void on posterior The curve correct and both T1 and T2 likewise panel Q R2 minus fistula. Progressive bilateral leg weakness. MRI numbers find with multiple corridors due with signal wide on a posterior aspect of corridor on both T1 and T2. Most likely diagnosed spinal to the artery venous fistula. 93 woman with personalities and ear. Okay. Woman with personalities and ear dizziness. Hearing loss. MRI shows mass in the right jugular fossa. Mass in the right jugular fossa. Most likely diagnosed glomerular. 94 most common site of intracerebral bleed in urine is germinal matrix. Most common site of intracerebral bleed in cell is germinal matrix. 93 glomerular. 95 55-year-old woman was being investigated for right lower limb weakness. On MRI, there was a well-defined high signal area in the right S1 lateral recess. There was expansion of the right neural canal with bony scalloping. Nerve roots were light along the wall of the cyst, where the most likely diagnosis of cyst. Now, on there was a MRI, there was a well-defined high signal cystic area in the right S1 lateral recess. The expansion of the right neural canal, bone scalloping. Nerve roots are right along the cyst. Diagnosis: the tunnel of cyst. Large cystic lesion in the right lateral recess of the S1, and nerve roots are related around the wall of the cyst. Most likely diagnosed tunnel of cyst. 96. The hemangioblastoma T1 and enhanced immune nodule on T2. So, a 48-year-old young man comes for ultrasound due to vague abdominal pain for 6 months. On examination, his vision filled bilateral abnormal masses, ultrasound in large kidney, VHL sign and symptoms with multiple cortical cysts restoring outline. Creatinine and PUN levels are normal. Simple cysts are seen in liver. Perennial imaging to be performed. CT brain angiography, CT brain angiography. Basically, he has bilateral renal cysts. So, when renal cyst, polycystic kidney disease, there are also cysts in the liver, which is associated with subarachnoid hemorrhage and perianeurysm. aneurysm. So, we have to do CT brain angiography. 97. Pain with genetic condition known as bilateral renal cyst undergoes MRI braining shows cystic lesion with mural nodule, cystic lesion with mural nodule in the cerebellum. Another lesion in the midbrain is found associated with VHL angioblastoma. T1 and the T2 enhancing mural nodule associated with VHL angioblastoma. 98. Again, this is cycle section hemangioblastoma. 98. 25-year-old man has an MRI for chronic headaches. On MRI, there was a cystic mass with enhancing nodule in the left temporal cortex. The mass had an enhanced dural tail and inhibited only minor presbyteric edema with most likely diagnosis pleomorphic dangerosarcoma. Hint is that it is seen in the temporal region most likely. Enhancing nodule mass in temporal region with mild edema diagnosed pleomorphic dangerosarcoma. 99. 14-year-old boy presents with a progressive history of gaze and speech disturbance on both T1 and T2 MR imaging. Lobus pallida are markedly hyperintense, except for a small central region of high signal intensity. Lobus pallida are both markedly hyperintense, except for high central region of high signal intensity. Eye of tiger sign, most likely diagnosis, Haller-Warden-Spart syndrome. Haller-Warden-Spart syndrome. Okay, question 100. 4-month-old male undergoes investigation for microcephaly and hearing loss on enhanced CD brain. So several polyventricular subabdominal cysts and multiple calcification per polyventricular region. Diagnosis: cytomegalovirus infection. 101. A 35-year-old previously well female concerned ophthalmologist with a history of progressive loss of visual acuity over several months. Retina examination, she was papilledema, enhanced CD shows tubular thickening of optic nerve, with intense calcification, post-contrast injections was not enhancing optic nerve shortened by multi-enhancing soft tissue mass to diagnosis meningioma, after meningioma. So optic nerve surrounded by soft tissue mass and it shows calcification, diagnosis perioptic meningioma. There is also patient have a history of loss of visual acuity and meningioma because it affects optic nerve. 102. Okay, tetheral cord is abnormally low cord. An 8-year-old girl presents with back pain, quickly there are double curved scoliosis convex to the left, the thoracic region and to the right in lumbar region. There is focal no focal neurology. MI shows the corners behind the L3 vertebral apparent terminus 3 mm in thickness at the L5 S1 level. A high signal lesion is seen in the T1 T2 imaging the canal behind the L5 S1 vertebral body. Multi diagnosed tether cord. So tether cord is abnormally low and terminating at L4 L5 level. Cord and is also uh, 3 mm in thickness, which is large for its normal size. Diagnosed tether cord. 103. Then glomus tympanicum. 64-year-old man with cramps carcinoma of lung present and on examination is known to have this arctic speech and division of the tongue to the left. She is brain unremarkable but review bone windows at the structural legend and the left side of the skull. Page consistent with bony metastasis, which is the point cell base is most likely to be involved. Capital canal. Okay. This is that the patient is 64-year-old with cramps carcinoma of lung and he has difficulty in speaking. On examination, so this arctic speech he has deviation of the tongue to the left. So his tongue involvement is seen in hypoglossal nerve involvement is seen in hypoglossal canal. 104. 55-year-old woman complained of left rod bill pain and double vision. On examination, she was found to have left 3, 4, and 6 nerve palsies. She has no past medical history and is otherwise well. Image demonstrated abnormalities in the ipsilateral criminal sinus and superior orbital fissure, with most likely diagnosis also a heart syndrome. It involves the 3, 4, and 6 nerve palsies and superior orbital fissure. Question 5. There is again glomus tympanicum. Now, 37-year-old woman was being investigated for pulmonary and found to have orthoscopy of blue mass deep tympanic membrane. And there was TC the small left side soft mass depending on the left complementary. This enhances brightly with short draws. Was very diagnosis glomus tympanicum. It affects the cochlear promontory and blue mass deep tympanic membrane. So glomus tympanicum. Next question number 106. Where is the diagnosis of craniopharyngioma? 26-year-old man with headache and visual disturbance found to have a pattern bone amnopsia and visual field testing. Serial brain demonstrated multilobulated heterogeneous supracellular mass containing cystic areas and rim-like